Complications of sciatica. What can happen if you leave sciatica untreated and it is allowed to progress? So, to refresh your mind, sciatica is basically a pinched nerve of the lower back. And because the sciatic nerve supplies the leg, any insult to the sciatic nerve can lead to symptoms in the leg as well, such as the classic pain, tingling, and numbness. Now, if sciatica is not treated and allowed to progress and worsen, certain complications can occur. So I will discuss main complications. The last one is a medical emergency, so you may want to stick around for that. The complications I will discuss are chronic pain, muscle weakness, muscle loss, and cauda equina syndrome. Chronic pain. So if the nerve compression is allowed to continue and or get worse, you can end up with a permanently damaged nerve. Think of a nerve that is not completely cut, but rather a section that is permanently crushed and never fully heals. Because of this crush point, you will permanently have improper signals being sent to the brain that may be interpreted as pain. It is possible that with time, as the nerve heals, you may experience less pain. But if the nerve never fully heals or never fully reverts to its normal state, you may have some degree of pain permanently. Muscle weakness, difficulty walking, and drop foot. Now, nerves are responsible for sensation as well as muscular contraction. If sciatica is allowed to progress, you may move from mild pain to severe pain with tingling and numbness in the leg. And as it progresses further, you may experience muscle weakness in the leg and the foot. You may find it difficult to walk and you may need to use crutches. You can also develop a condition known as drop foot. This is where you are unable to dorsiflex the foot or pull it upwards. In a case like that, you may need to wear a foot splint to help with walking. Muscle loss in the leg. In addition to loss of muscular strength, you can actually lose muscle size in the leg. A muscle will lose size when the nerves that innervate it are interrupted or injured in some way. Now, a number of years ago, I did get a pinched nerve in the neck. Now, the principle is the same, whether it's a pinched nerve in the neck or in the lower back. In my case, I got a pinched nerve in the neck, and these two fingers went numb. I lost strength in this arm, and the arm actually shrunk. Now, at the time, I was studying medicine, so I basically went to my medical books, tried to figure out what was going on, and I was able to engage in therapy at home, and I was able to make a 100% recovery. Now, I was able to make a 100% recovery because I acted quickly and initiated therapy at home. Cauda equina syndrome. Now, this is a medical emergency or a neurosurgical emergency, so listen up. Now, cauda equina means horse tail, and it refers to the bundle of nerves that come off the end of the spinal cord. The spinal cord actually ends at the level of L1, L2, and the bundle of nerves that extend from beyond that point is the cauda equina. Now, if a disc bulges into the spinal canal and compresses the cauda equina, it can lead to sciatica in one or even both legs. The symptoms of cauda equina syndrome are difficulty walking, lower body paralysis, sudden pain and weakness in both legs, numbness between the legs and in the genitals, sexual dysfunction, and you can even lose control of your bowels and bladder. So again, this is a medical or neurosurgical emergency, and if you are experiencing these symptoms, you need to get medical care as soon as possible. So I hope you can now appreciate how mild sciatica, if left untreated and allowed to progress, can lead to certain complications.
Call us today at 747-5297 or 308-3370. We are located at 4 Chincuna Gardens, Chin Chin Road, Cunupia.
You can tap the description below for all of our contact information.